Alright, this is going to be a review of urinary system and introduction into the reproductive system. We're going to start here on this model. As we can see, here's the abdominal aorta, inferior vena cava, and let's look at some of our landmarks. Celiac trunk, it's been cut close. Superior mesenteric artery, inferior mesenteric artery. There's our right gonadal artery, and here's our left gonadal artery. These are the renal arteries on the left, and one coming around to the posterior on the right. As we can see in the posterior view, a better representation of the renal arteries. The kidneys lie retroperitoneal, as well as these large vessels. We can see the kidney, the left kidney, with the suprarenal gland, also known as adrenal gland. You note a major landmark here. Left renal vein crosses over the abdominal aorta. Just superior to this, you have your superior mesenteric artery. Classically, we're going to see the left suprarenal vein drain into this left renal vein, as well as our gonadal vein that comes up on the left here and drains into left renal vein. This is a classic landmark and representation that you should always look for. When we talk about gonadal vessels, in males it's going to be testicular artery and veins. In females it's going to be ovarian arteries and veins. The bifurcation at the lower edge here, this is going to represent our common iliac arteries, and you can see on the posterior here the common iliac veins. What this model does not represent, and I'm going to use my fingers, there's a bifurcation that comes inside towards the true pelvis, our internal iliac arteries, and these that come out towards the outside are the external iliac arteries and external iliac veins. There's a inguinal ligament that comes across like this to the pubic tubercle, and what exits is going to be your going to the exterior here, femoral artery, femoral vein. Let's focus back on the kidney. Left kidney. The right kidney is slightly lower than the left kidney. I'm sorry this model was broke, but here's a representation of an atrophied right kidney. It's slightly lower. We have a renal pelvis. It can be better viewed on the posterior side. These are going to drain into two lines, ureters. I think of it ureter because it's two E's, ureters, into the urinary bladder. So renal pelvis drains into the ureters. At the bottom here, I'm going to do it kind of sideways so you can kind of see this, anterior, posterior. This is a urinary bladder. Inside, we can see urinary bladder rugae. These are the folds. Here is the ureter openings at the very top of what we call the trigone. Here's the opening to the urethra, and we have given it different names along its journey. Because this is a male, And you can see there's a prostate gland. We're going to have what we call prostatic urethra. Just below this, there's a floor of the pelvic wall. We're just going to call this urethra below this segment, a very short segment called the membranous urethra. It may be visualized on this model as we get to that. As we can see, what is visualized on this model, seminal vesicles, the seminal vein that produces semen, and part of the vas deferens, also known as ductus deferens. This is the sperm conduit to bring the sperm inside towards where these all join into ejaculatory duct. We cannot see it in this view on this model. Alright, we have another model here just to tie in with that previous model. As we can see, coming through the diaphragm, you can see the abdominal aorta. We can see inferior vena cava. There's our celiac trunk, superior mesenteric artery, inferior mesenteric artery. And of course we have a lot of our lumbar arteries and veins, but we're focusing on some of these vessels that goes to different organs. As we can see, these are our right gonadal artery and vein, and here on the left, notice coming off the abdominal aorta, left gonadal artery, and there is that return line, left gonadal vein, as you can see it draining into left renal vein. This actually shows a nice representation of this suprarenal gland and its suprarenal vein draining into this left renal vein. There's our left renal vein coming from the kidney all the way to the inferior vena cava. And here on the right side, right renal vein, and there's coming from around the posterior side, we can see that from the abdominal aorta, right renal artery. There is our bifurcation, common iliac artery and veins. On this model, we actually can see, I'm going to turn it up so we can actually see inside here. You can see the internal iliac arteries in the bifurcation, where the external iliac arteries and the accompanied veins. Here, we can see the ureter on the right and the left coming from those renal pelvis, draining down inside to the urinary bladder down below. Let's look at this kidney. In the kidney, the outer aspect of the kidney is called the cortex, the renal cortex. You can see these little pyramid-shaped structures. These are where the collecting ducts are, all merging into this common collecting funnels, minor calyx. And these are the pyramids of the medulla. The medulla means the core, or the center of this organ, and the outer cortex is the outer part where a lot of this function of the nephrons take place. Filtration, fine-tuning of the blood. These minor calyx drain collectively to larger funnels called major calyx, so the minors to the majors, and then from the majors into the renal pelvis. That which pretty much goes in renal pelvis, becomes urine. Here we can see coming up from this region. It's very difficult on this particular model, but we'll show you on the next model. This is the vas deferens or ductus deferens coming in from the spermatic cord. Okay, we have another model here showing the male reproductive system, urinary bladder. As we can see, the vas deferens. This one actually shows us where our spermatic cord, this has our vas deferens, gonadal artery, gonadal vein, cremasteric muscles, all within, and it goes through what we call inguinal canal. It's an opening all the way to the peritoneum. This is actually very important clinically to understand this inguinal canal. Now, let's turn this model over. Very similar to the previous model where we saw the male reproductive system, vas deferens, seminal vesicles. Here is the left ureter. There's the prostate gland, as we can see. For reference, here's where the sigmoid colon curves and starts into straightening out to the rectum. We have the scrotum, scrotal sac. This holds the testes, which are the male gonads. The penis, or the shaft of the penis. The head of the penis, we call it glans penis. If it has a foreskin, we call this prepuce. Let's take a look inside. Here we see urethra going through the prostatic urethra, membranous urethra, to the penile urethra, sometimes referred to the spongiosum urethra because of this tissue, but we're going to call it penile urethra. As you can see, this little line right here, this is where our vas deferens, seminal vesicles join into this prostate gland, into what we call the ejaculatory duct. What is not well shown on this, there's coming into, after this membranous urethra, a small organ known as bulbourethral gland, which is going to produce the pre-ejaculate. Seminal vesicles produce the semen along with prostatic fluids, producing the ejaculate. Sperm produced in the testes. As we can see, surrounding the penile urethra and the glans penis, we have what we call corpus spongiosum. This will engorge along with these erectile tissues to create an erection. These regions right here, and there are two of them, side by side, we call this corpora cavernosa, because plural. If we look at one side individually, corpus cavernosum. There's the dorsal vein of the penis, represented here. Let's look at down inside the scrotal sac. The testes, the outer covering of the testes, are known as tunica albuginea. And there's a little, it looks like a cap on top. This is our epididymis, the head of the epididymis, going down to the tail. This is where the sperm is going to finish its maturation and then come up to the conduit called the ductus deferens or vas deferens. The coverings, as you can see, the testes are allowed to rise up and down due to temperature changes. For normal maturation, we need a few degrees cooler for normal sperm development than the core temperature of the body. So we have cremasteric muscles that rise and lower the testes. This is allowed because there is a scrotal cavity that has a lining. This is known as tunica vaginalis. This allows the testes to raise and lower within the scrotal cavity. Okay, I have another model here, and I want to show you on the inside here a little better representation of the tunica vaginalis. As we can see, is this region here, this outer covering. It's kind of like a visceral and a parietal covering. On the inside, you can see the testes, the tunica albuginea. There's the head of the epididymis, and then the tail. This one's very unique. That's what I want to open this up to show you, where it shows you the bulbourethral gland right here. And this is going to produce the pre-ejaculate that's going to help clean the lines and help lubricate the head, which is the glans penis. Okay, we have a female reproductive model. Here we can see inside, urinary bladder will be anterior to the uterus. Here we can see the fundus of the uterus. There's the fallopian tube, also known as uterine tube, overlying the fimbriae, which overlies the ovary. That's the female gonad. Here is ovarian ligament. This fatty covering over the pubic bone is the mons pubis. The vulva is this external region opening over the genitalia. As we can see, urinary bladder. Here's the external urethral opening, or meatus. Here's the vagina, clitoris, outer genitalia, the outer lip is known as labia majora, the inner lip, labia minora. The opening between vagina, clitoris, this is going to be known as the vestibule. Vaginal opening. Towards the posterior aspect, we can see the uterus, the neck of the uterus, into the vaginal canal. This is the cervix of the uterus. This little pouch up here is known as the fornix. This is actually a pouch that helps hold sperm in the ejaculatory phase of copulation, and orgasmic phases help contract the uterus to dip down into the fornix to capture the sperm so that it will be allowed for fertilization. This is the external cervical os, internal cervical os. Layers of the uterus, endometrium, myometrium, and perimetrium. This is all surrounded by what we call the broad ligament. I have another model here of the female reproductive organ. As we can see, labia majora and labia minora, clitoris, opening, the urethral opening, vaginal opening. This is the vestibule. As we can see, the uterus, urinary bladder, vagina. This is the rectum, and there's the anal opening. This is where the sigmoid comes into the rectum. Pubic symphysis, clitoris. So let's look at the coverings and the abdominal wall. Now we're going from a posterior to anterior view to see this. The fundus of the uterus, fallopian tube, fimbriae overlying the ovary, ovarian ligament. Here's the round ligament of the uterus right here, holding the fundus to the anterior. The outer covering of connective tissue, which is in a sense a continuation of that retroperitoneum, is going to be known as the broad ligament. That which covers the uterus, we call it the mesometrium. That covering over the fallopian tubes, we call it mesosalpinx. The covering over this ovarian ligament is known as meso-ovarian. Let me demonstrate this with my shirt here. If you have an overlying uterus on different planes, over the uterus would be the mesometrium, and then like this, same plane, I'm just representing with my fingers inside to show you like the fallopian tube covered by this broad ligament, mesometrium, and on another plane, mesovarian, all part of this broad ligament. Very difficult to see on a model, very identifiable on a cadaver.